Good afternoon, and welcome to the annual Caring Hope for Community Health Luncheon. I'm Phil Poley, Vice Chair of the Caring Board of Directors. Thank you for being with us today. As much of our lives have moved to these virtual platforms and your time has become even more limited, we are truly grateful that you have committed some of your time to learn more about caring. The theme for this year's luncheon is Shine the Light, and we think it captures perfectly the moment in which we find ourselves. COVID, a sharp rise in the uninsured, the shift to Medicaid managed care, the ascendance of telehealth, and so much more. These changes are what Caring was built for, and now more than ever, our mission and commitment to help those in need, even in these dark moments, led us to shine the light. Caring stands as a beacon of light for those in need, scanning their horizon to spot opportunities and threats, and ensuring we continuously improve and adapt to meet the needs of the people who rely on us for life-saving care. As you can see, we have a lot to share with you today, and later you will have the opportunity to invest in our mission and help thousands in our community who need your help. Since we're hosting this a little bit differently this year, I want to provide some guidance for navigating the platform we're using today. Now that we are in our presentation, your microphone and camera have been disabled. Neither the presenters nor the other people at your table can see you or hear you. If you'd like to talk to a specific guest at your table, or all the guests at your table, simply use the chat function on the right side of your screen. Also, please be sure to check in the general chat window for a link to make a donation to Caring. At the conclusion of the program, you will be able to return to your table to visit and network. I also want to take this opportunity to thank our corporate champions, many of whom are long-term supporters of Caring. Quite simply, our work would not be possible without them. Corporate donors at the $5,000 level and above include OrthoCarolina, Blue Cross and Blue Shield of North Carolina, Wells Fargo, Atrium Health, Novant Health, Bank of America, Nuveen, Foundation for the Carolinas, Morin Van Allen, United Healthcare, and WellCare. Before we proceed, our presenting sponsor, OrthoCarolina, has prepared a special message for you. I hope you enjoy it and the rest of the program, and thank you for supporting Caring.
So my name is Blair Primus. I'm the Senior Vice President for Marketing and Talent Management at OrthoCarolina. Thanks everyone for being a part of today's Hope for Community Health Luncheon. OrthoCarolina is thrilled to help make this possible for the community again this year and all of the years we've supported it in the past. While we know this one is going to be different, we're equally as excited about you participating and being involved and engaged in the health care of our local community. OrthoCarolina has for years been dedicated to giving back to the communities that we're a part of, the very communities that we see our patients in. And being a supporter and a partner with Caring is a terrific representation of that commitment. The organization does so much to help make sure that the underinsured and the uninsured get the care they need to create the opportunities for health and well-being on as much of an equal footing as possible for the rest of our communities, for those that have the ability to do so. OrthoCarolina is really excited to be able to make this possible again for you this year. Take care, have a great day.
Hi, I'm Colleen Hull with Atrium Health and a member of the Caring Board. I first became familiar with Caring about 4 years ago when a fellow colleague shared with me her involvement with the Nurse Family Partnership, one of 3 of Caring's programs. As a nurse, I have seen the tremendous impact of helping young mothers and babies get a great start. So I was honored to join the board about 3.5 years ago. I'm excited as a board member that I get to share more with you today about this great organization and why I feel compelled to be a part of it. For more than 65 years, Caring has been on the front lines in improving health and wellness in Charlotte. From Caring's earliest days, the mission has remained the same: to help individuals with limited resources establish and maintain good health. Here in Mecklenburg County, 1 in 5 people are not able to access the care they need. But to drill down even further, there are stark disparities that exist in healthcare for people of color or who are living in poverty. Life expectancy, if you are African American, is 5 years less than if you are white. African American infants are twice as likely than white infants to be born premature. And low-income adults are twice as likely to report having diabetes or cardiovascular disease than adults with higher incomes. We at CareRing believe being well and being healthy is absolutely essential. Without good health and without access to affordable quality care, no one breaks the chains of poverty and climbs the upward mobility ladder that we all know is so important. To live out our mission, we support our clients through a variety of programs. And within each of these programs, we had a record year this year, providing more services than ever before. First is our Physicians Reach Out program, with more than 1,500 volunteer doctors from Novant Health, Atrium Health, OrthoCarolina, and medical practices across our region. This incredible network of providers donate care and services to the uninsured, and last year they cared for an all-time record number of patients, having served over 6,000 individuals. Nearly 20% more received help through this program than the previous year. The total care donated by these providers is also the most donated in a single year, more than $51 million. Such an incredible testimony to the value of this program and to the commitment from our local medical communities to care for our neighbors. Similarly, our clinic, which provides access to a range of low-cost, excellent primary care services, saw a 10% increase in services, having more than 4,600 patient encounters. The vast majority of our patients have multiple chronic conditions and have not seen a doctor in a year or more. But through the tremendous care of our providers and dedicated leadership of our longtime medical director, Dr. Karen Saylor, our patients achieve amazing outcomes. Nurse Family Partnership, our home visiting program for moms with limited resources, also expanded over the last year. We served 367 families, graduated 70 adorable 2-year-olds from the program, and added our 12th nurse to the team, bringing this proven poverty-fighting program to more families in our community. And behind each of these programs is our team of case managers and social workers. They are part of what makes our program so unique and successful. They spend their days connecting clients to a wide range of supports like housing, transportation, workforce skills, and food access, addressing needs beyond their immediate clinical care, and where possible, eliminating barriers to a healthy and self-sufficient life. Beyond our successes, we're also experiencing extreme challenges, as everyone has since COVID has hit. COVID-19 overturned all of our lives. CareRing's patients were hit especially hard in multiple ways, making our work and ability to keep helping people through this crisis especially critical. To share more about how we responded in those early days, we have a brief video that I'd like to share with you now.
Face masks will
are
now be
testing
required
positive
across the
for the
state of
virus,
North
an average of
Carolina
about 1,000 a
anytime you
day
go
over the
out
last 2
public.
weeks in North
Americans
Carolina.
lost their jobs
Even if a
just
small
in the past week. Wake up, Charlotte.
When COVID hits in mid-March, it was pretty clear almost overnight that if we want to do business, we have to change dramatically how we provide services. Because we knew that the patients that we care for, their lives have been turned upside down as well. We got to figure out how to get our staff working and being productive, not coming into that building overnight. And our patients have never needed us more. So we have to be able to do this. We have to make this work. What we saw almost overnight, within a week after this occurred, the reports that were coming in from our case management team were staggering. There was an immediate lack of food for their families. You know, there was 3 days of food was the maximum that they and their families had. The crisis in housing, the ability to feel confident that they're going to be able to make their rent check at the end of the month. Many of the people that we serve are not documented individuals, but we believe they deserve just the same amount of care as everyone else. They were isolated before COVID. Now they're terrified to come out, and they're terrified to access not only our services, but a range of other human and social service needs. And our patients were dealing with everything in their lives. And One thing that we were not going to allow to be a barrier to care was for them to pay a penny to see us. So we immediately waived the cost to come to our clinic or be a part of Physicians Reach Out to access anything that we did. Wasn't in our business model. No, we just did it because we knew we had to do it. We knew it was the right thing to do, even though it wasn't part of our budget. We had to become a telemedicine provider overnight. Maybe 2 weeks after the stay-at-home order, we were seeing more patients in a day, when you include the telemedicine, than we've ever done in the history of our agency, because we adapted to this technology so quickly. In the populations that we serve, we've known long before COVID that there are disparities in care. African American folks, the Latinx people, they were not receiving care at the same proportionate level we would expect everyone to receive. COVID opened the curtain to society to see many of these disparities that are very real in people's lives, but it made it much more urgent. I became really concerned about our own team and our own staff that were they'd finish helping in every way they could on the clinical and non-clinical needs of folks, and then they'd hang up the phone and the next one would be the same story. Story after story, I was worried and still am, frankly, about the mental health and the balance that our staff has having to adjust to this reality of a super high intensity need on every single patient that's coming to us. The senior team that really runs the agency, the pace and the rate of change that they were able to lead this agency through is it's absolutely remarkable. Make adjustments on the fly and continue to get great outcomes. I mean, this last year, which included part of COVID, our outcomes were extraordinary. I mean, we served more people, we received more money in donated care from the larger hospital systems, we grew the Nurse Family Partnership Program. We just, COVID or no COVID, we just kept going. We just kept pushing through it. And that's just a tenacity and a strength of character and a real passion for our mission and what we do. I'm proud every day of the team. You know, their commitment to do what is needed in the community. They know it's the right thing to do, and they know it's the right way to go forward. And I know, I got a team of people that all embrace our mission, and they're willing to do whatever it takes. Drive food to a family, stay late and work through an issue with a family, learn an entirely new technology you've never seen before because you've got to get that mom and get her ready for the baby that's coming. I mean, it's still remarkable every day. I only wish we could do more of it.
As Dawn mentioned in that video, Caring made quick and necessary decisions to keep client services as seamless as possible, with perhaps the most important decision being to stop all service fees for clients during those first several months. This was simply the right thing to do, and thanks to donors like you, who gave directly to Caring, and the generous donors who gave to the United Way Foundation for the Carolinas COVID-19 Relief Fund, we were kept whole and able to serve every client who came to us. As COVID-19 continues to disrupt all our lives, big questions remain about how this virus impacts Caring and the people we serve over the next year. With the job market slow to recover, will the patients we care for be able to make a small contribution to offset the costs for their care? How can we address increased need for mental health support? And with an expected surge in need, as so many have been bumped out of employment and the private insurance market, will we and other safety net providers in the region be able to fill the gaps? These questions will continue to guide us as we remain vigilant and nimble in responding to the needs of the community. Before we go on and share more about what's on the horizon in the coming year, our board chair, Mark Markowitz, has some important news to share with you.
Good afternoon. As Colleen mentioned, I am Mark Markowitz, and I'm serving in my second year as board chair. As many of you may have learned by now, Caring's executive director, Don Jonas, has stepped down from his position after more than 8 years with us to pursue a great opportunity with Atrium Health. During his tenure with Caring, Don has directed efforts to expand Caring's healthcare access programs for people with limited resources. Under his leadership, the organization has grown in scope and capacity for services. Since Don's arrival in 2012, Physicians Reach Out has increased annual program enrollment by over 50% and total annual medical charges donated by 400%. Our clinic has further strengthened its position as a trusted medical home for 2,000 patients a year. Nurse-family partnership has grown from a team of 4 nurses and 100 families to a team of 12 nurses and 300 families, to the creation of a new case management department staffed with nurses and social workers. We have dramatically increased our capacity to provide chronic disease management, care coordination, and social work support for caring's most vulnerable patients. Don's collaborative spirit and passion for helping people with limited resources has paved the way for caring to grow and thrive. He built creative partnerships across the community's safety net that improved our clients' lives. He made pivotal connections with funders that opened doors for caring. And he helped create a vision that positioned caring as a leading voice and advocate for creating better system of care for all. For all these reasons and so many more I don't have time to mention, we are grateful for Don's contributions and know that he will continue to do great things for our community. To continue our momentum during this time of transition, the Board of Directors has engaged Leverage Resources, a Charlotte-based firm with extensive experience providing interim nonprofit leadership services for nonprofit agencies. Reed Cochran with Leverage has stepped in as Caring's interim executive director and brings significant leadership experiences in the nonprofit sector. She is working with our leadership staff and the board to maintain stability as a formal search committee works to identify Caring's next permanent director. I hope you'll join me in welcoming Reed Cochran as our interim executive director. I want to assure the community Caring is well positioned to continue to grow our impact across the Charlotte region. As you are hearing today, Caring's work in the community has perhaps never been more important than during this pandemic. I, along with the rest of the board and staff, look forward to continuing our more than 65-year history of helping individuals with limited resources establish and maintain good health. Thank you.
Hi, this is Don Jonas. I'm so excited you guys are here for the annual event, this time in a virtual format. It's been my incredible honor and great professional joy to be a part of Caring for more than 8 years. Done extraordinary things, mostly because we have this incredible staff, and we have a super gifted board, and we have passionate volunteers that come to help us make a difference in people's lives every day, the same way we've been doing it for more than 65 years. And while I've departed, the Caring goes on just as it has in the past. I'm super excited about the direction, about the strategy, and I'm so grateful for each of you for supporting the work that we do at Caring every day. Thank you so much for the opportunity to lead this amazing agency. Thanks.
Hi, I am Morgan Hinton with Premier and a Caring board member. I support this organization because we are working so hard to meet the critical healthcare needs for those in our shared community who are underserved. I, along with Caring, envision a community that promotes, protects, and improves the health and well-being of all people. You previously heard from Colleen about the outcomes and impact Caring has had over the last year. All of this work is in service to Caring's strategic plan, which includes affirming and promoting our unique access to care model and expanding nurse-family partnership in our region. And while there is so much great work being done, there are so many more who need our help. In addition to the many ways Caring directly helps individuals establish and maintain good health, as a part of our strategic plan, we are also actively engaged in advocating for a better system of care for all. This includes the important work of engaging with communities to better understand their needs as it relates to health and well-being, identifying barriers to addressing those needs, and providing education on the changes that are happening in healthcare. By building deeper connections with neighborhoods, we can improve overall community health and outcomes for people with limited resources. Greer Heights is one such neighborhood where we've been working on site for several years now. As a descendant of the Greer family who founded the Greer Heights community many years ago, I have a vested interest in the upward mobility and health and well-being of its residents, many of whom I'm proud to say are my relatives. A few months ago, we began a new multi-year collaborative project with residents and leaders in Greer Heights and U City Family Zone, which is a place-based collaborative around University City. As a part of this project, we are learning more about the healthcare needs and community health goals of these unique communities and will share our lessons learned with the broader healthcare system and other community-based organizations. Moving beyond the advocacy work of creating a better system of care, Caring also plays an essential role in Charlotte's care safety net. We serve as a critical link to specialty services for the uninsured, ensuring access to comprehensive care for all patients served by the Safety Net network. To extend those efforts further, Caring is involved in a wide range of community projects and collaborative efforts, including offering breast health services through continued funding from Komen Charlotte, and offering access to care and substance abuse education through support from the Mecklenburg ABC Board, as a few examples. As you can see, Caring is a provider of affordable, accessible health services, a connector to specialty care for the uninsured, a champion for new moms and their babies, and most recently, an advocate for imagining and creating a better system of care for all. But as Caring reflected on the last year, we were reminded that while we were able to serve more people while simultaneously meeting or exceeding outcome measures across all of our programs, we also came to a much fuller appreciation that none of this work is possible on our own. Nothing we do is possible without being in partnership and in solidarity with countless community partners. The challenges our clients have faced have always been daunting. As the pandemic hit, our clients and their families' lives were thrown into even greater turmoil. We heard from the people we serve nearly every day after the pandemic took hold last spring about their urgent need for basic support across a range of human and family needs. So as we thought about who best to honor with this year's Maribel Conrad Award, named in honor of Caring's founder and first leader for her dedication to improving health for all, we decided to take a slightly different approach this year. We usually recognize an individual in our community who demonstrates through his or her efforts the passion and commitment of our founder with this annual award. This year, rather than recognize a single person with this award, we have chosen to recognize an agency partner that has provided heroic, tireless, loving support to all. This local agency has stepped up when our community most desperately needed them. They have been incredible partners not only to us, but also the entire community in providing support to those most in need during the pandemic. On behalf of the board and staff of Caring, it is my great honor to announce the recipient of this year's Maribel Conrad Award is Loaves and Fishes of Charlotte. Here's a brief video presentation of this recognition.
Our annual Maribel Conrad Award is usually given to an individual that has done something extraordinary in healthcare. And it's usually been someone that's a clinical leader in our community. This is the first time ever that we have recognized a peer organization that's not a traditional healthcare provider. Ordinarily, we look for clinicians, physicians, folks that are part of Physicians Reach Out, other individuals that are helping with access to care. But with COVID-19 as it hit, it changed everything. I mean, the entire way that people need the primary and the specialty care that we can get them, they need access to food and housing and a host of other issues. But at the very fundamental level, nothing that we could do would work if we couldn't make sure our people had access to food and their families. And so we huddled as a group and we thought, let's do something a little bit different this year. Let's honor an agency, let's honor a partner, let's honor a movement to make sure that everybody in our community, if they need it, have access to food.
We've been lifelong partners with our friends at Caring, but we knew very early on when COVID hit that we were going to have to pivot in some different ways. We knew that demand for food was going to go through the roof, but we knew we had to serve people in different ways. So we immediately had to close our brick and mortar pantry locations and offer a mobile option and a home delivery option. So there were triple the number of people to feed, and we had to do it with our volunteer base cut in half. Thanks to the support of volunteers and partner agencies like Caring, we did not have to turn away a single person who needed our services during these critical times.
My name is Nicola Taylor, and myself, along with Marcia Kelly, represent the Migrant Assistance Project. We are a group that assists Central American asylum seekers as well as other members of the Latinx community. Loaves and Fishes has been a critical partner for us. They have done just an amazing job providing food to over 410 families of ours.
My name is Faye Wright, and I am a pantry coordinator for Loaves and Fishes. I also serve on the board of Loaves and Fishes, and I have been with the organization for 25 years. When we were in the pantries, we get all these expressions of love from the clients. They would say thank you for the food that they receive. Being with Loaves and Fishes for 25 years, I just see the growth that we've had in the organization, and what the mobile pantries are doing in the city of Charlotte 6 days a week is phenomenal.
I am so excited to announce that the winner of this year's Maribel Conrad Award is Loaves and Fishes. What an awesome partner for our community, for our patients. I don't know what we would have done without you. You're so deserving. Thank you so much for being such an amazing partner in our community.
We want to thank Loaves and Fishes and congratulate them for this very well-deserved award, and thank them for all they're doing in our community, and just keep up the good work. Thank you.
So Loaves and Fishes need to be commended for what they're doing in the city of Charlotte in feeding people.
Loaves and Fishes is overjoyed to receive an award such as this from a partner agency. So from the people at Caring who spend every day in the trenches, side by side, working together with Loaves and Fishes to make sure that neighbors have access to healthy, nutritious food. And so to be honored and recognized by our friends and allies in this fight is just overwhelming. Thank you, Caring!
Good afternoon. I'm Brisa Hernandez, System Director, Population Health and Engagement with Common Spirit Health, current Caring Board member and past chair of the NFP Community Advisory Board. My involvement with Caring goes back even further, before I was a committed volunteer. Early in my community-based research career here in the Charlotte area, I worked with a team of researchers engaging community members and key partners to understand the barriers to accessing healthcare services for the newly arrived Hispanic immigrant community. Caring was not only a key partner, but also has always been open to taking the research findings and applying them to how they operated and provided care for many community members they serve. Caring has always been open to not only look at the data, but also the importance of considering the lived experience of their patients and care teams to translate it into better services for their patients. This is community health in action. There are so many in our community facing these challenges, and I want to share one such client story with you. Carmen is a daughter, a sister, wife, and mom to 3 children ages 17, 13, and 8, and was recently referred to us with a serious breast cancer diagnosis. Here's Carmen's story.
En junio del 2019 sentí unas pequeñas molestias en mi seno. Yo voy donde la doctora. Ella me refirió a hacerme mamografía y me hicieron una biopsia. La biopsia dijeron que tenía una masa, pero no era mal. En marzo me volvió a salir algo como una bolita. Y me hacen otra vez estudios y la biopsia. Y ahí sí fue lo triste. Me llama la doctora y me comenzó a contar ella lo que pasaba en mí. Y fue tan duro. ¿Qué me está pasando esto? Le dije. Fue doloroso, muy doloroso. Pero dice, tú vas a salir adelante. Y yo le decía, no. La doctora me decía, es muy grave, cáncer invasivo ductal. Tiene que hacer muchos estudios lo más rápido posible. Es que este cáncer, dice mi doctora, se va para los huesos. Cuando le dan las noticias, piensa, me voy a morir. Tengo hijos, ¿qué voy a hacer? Y se me vino todo el mundo encima, ¿verdad? Al siguiente día yo fui de la doctora, ahí tenía ella su enfermera y ella me dio la información sobre la organización Caring para que buscara ayuda y me dijo no te preocupes. Ellos fueron muy lindos en el Live en Cáncer, es maravilloso, el personal es excelente, excelente. Yo nunca en mi vida he tenido doctores tan buenos. Me hizo una llamada cuando estaba con el cáncer, explicó soy trabajadora social de Caring y quiero ayudarte, quiero saber cómo estás. Nosotros nos interesa saber cómo están nuestros pacientes, a los que les ayudamos. Y muy bien, muy maravillosa. Y me explica todo punto por punto. Y si yo tengo preguntas, se las digo, me las responde bien. Ella es genial. Cuando me hacían quimioterapia, me tenían que hacer la prueba del coronavirus. Tenía 2 semanas que me habían hecho quimioterapia y me dio el COVID. Fue bastante duro. Dice la doctora, a mi modo, hay que esperar y cuídate, y aislamos a los niños y nos cuidamos muy bien porque a ellos no les dio. Tenía la cita con la cirujana y voy y dice, muy contenta, te tengo una sorpresa. Me dice, ¿qué? Ya no tienes cáncer. Ay, yo me sentí tan feliz. Ya no te encontramos ninguna célula cancerosa. Ay, bendito Dios, le digo yo que ya estoy bien. Yo estoy muy feliz con esta organización que me ha apoyado en todos mis gastos, porque si yo pago eso, ni en toda mi vida lo puedo pagar. Es algo maravilloso que ellos están haciendo, esta gran obra con las personas que de bajos recursos, como nosotros. Estoy contenta y que lo sigan apoyando a la organización para que ellos sigan ayudando a otras personas, así como me ayudaron a mí. Para mí es una segunda oportunidad que tengo y tengo que aprovechar.
Story represents why I so strongly believe in the work of Caring and why I believe in investing in this organization is important. The past several months have been challenging by almost every measure, and as you've heard today, people on the margins will continue to be living in crisis in the coming months ahead. Caring's continued community response is critical, but we can't do this work alone. We need your help to ensure our clients can access the care they need and that we are able to support new clients seeking help. Now is the time to consider how you can be a part of this incredible organization and make an impact in our community. Caring set an ambitious goal to raise $75,000 during this event and to have everyone in attendance make a gift. If we give generously, together we will reach our goal. There is a link included in the general chat window on the right side of your screen to complete your gift, or you can text your gift using the number that you see on the screen. As you consider how you would like to support Caring today, let me tell you about how your support will make a difference. $1,000 will help support a nurse providing prenatal education and guidance for a family in NFP. $500 will provide 5 well women exams with cancer screenings. $100 will supply a family in NFP with age-appropriate developmental toys and books. $50 will support a visit with a provider in our clinic for a patient in need of primary care. Our donation link provides you with 3 convenient giving frequencies: monthly, yearly, or just one time. For those selecting a yearly option of giving $1,000 or more, you will join the ranks of our Healthy for Life Giving Society. This multi-year giving society provides you the opportunity to make an impactful, long-range investment in caring, which has become even more critical during these uncertain times. We'll contact you to set the number of years you wish to commit to. Monthly givers will become part of our Healthy Habits Giving Circle. Your gift is deducted automatically each month, and of course, you can stop at any time. Over the course of a year, your $10 a month can provide 2 children with a school physical in Caring's low-cost clinic, ensuring they are able to enroll in school. A gift of $25 a month will ensure access to care for a patient in our clinic who has chronic disease like diabetes for a full year. Or if you prefer, you can make a one-time gift of any amount you choose. Gifts of every size are important and help Caring provide access to care and wraparound support services to families in need. I also want to be sure to mention, don't forget about employer matching. If your employer will match your gift, that's the easiest way to double your impact. Please check with your employer about how to qualify your gift for matching. On behalf of the board, staff, and volunteer providers with Caring, I want to thank you again for your attention today. The past year would not have been possible without your support, and we need you to continue reaching people with limited resources. We rely on you, as do our clients. Before we adjourn, I want to thank OrthoCarolina for their long-term, steadfast support and being our presenting sponsor. And congratulations to Loaves and Fishes on receiving this year's Maribel Conrad Award. I hope you have enjoyed this program, and when this concludes, you will stay on and visit with your table. You can share your thoughts with your ambassador and ask any questions you have. Thank you, and have a great rest of your day.